We're back, guys. We made it safely. Back from Dallas, y'all.
There was so much cowboy stuff everywhere. That's the only thing that I just
We thought Houston was like Texan like. Girl, boy. If you've been to Dallas, that's where it's at.
Yeah.
I mean, all the cowboys.
Yeah, like if you're ever in need of.
It's literally like rodeo season all the time there. So, it's pretty cool.
Yeah. So we promised and we did not deliver, but
we have a good reason why.
Yeah.
It was crazy.
Jam-packed with all kinds of information. I don't know if my face in this
Why not?
light. I don't know.
Wait, do we need to scoot closer?
Yeah, I think we'll use it. There we go. Okay.
Now we're in the middle. Okay. Cool. So, but our entire weekend, Friday through Sunday, was packed full of amazing things, so we did not even have a moment to breathe to get on and share some things with you guys. But we're back.
Literally after conference, we were like, do you want to go out?
My mind is like full. Yeah.
Yeah.
So but today,
thank you, Dr. Sukkar, for sending us.
Yes.
I feel like I have bags on my eyes. Okay, sorry, I'm gonna not. Okay.
You don't.
Anyway,
you can't look at yourself in the camera.
Okay, so today is one for the gentlemen in our lives and your lives. This is something that I didn't really know about growing up because I guess guys don't like to talk about puberty and all of that kind of stuff either.
Well, men I don't think they normally like to talk about as far as things going on with their body that they're not happy with.
But one thing we did learn this weekend is it is the Renaissance.
It is.
It is the year of men getting into their looks. I mean, you know, they're keeping up with their wives or maybe keeping up with the younger guys at work. So it's definitely something that we offer here, services for men. And now is it gynecomastia correction or is it?
Well, the procedure itself is called gynecomastia that we're going to talk about. It has to do with men's chest. And some things that are going on there that men usually aren't happy with, that they work their tail off to address, and sometimes things don't change, and there's a reason why.
And we talk about you know, with pool sculpting, with all that, with everything that we do here. You know, it's because you've tried other things, you've worked on yourself, you've dieted, exercised, and sometimes it just won't go away. Sometimes you need help from a surgeon. So gynecomastia, I was texting with Dr. Sukkar this morning, and I was like, you know, we were talking about gynecomastia, and I asked him, you know, like, what is just, you know, the simplified root of the problem? Because it is an issue, and it's not something that everyone develops or whatever. Exactly. So it's definitely brought on by hormones.
I'm looking at comments not being
so more often than not, it's going to affect younger guys. And then it'll stay on your body when you get older, and it looks kind of, you know, different because you can have this nice fit bod, and it's just out of place, right?
It's aesthetically distracting. It doesn't match the rest of what's going on. So a lot of times patients refer to this issue as like man boobs or whatever your term is. Yeah, it's so basically what we're going to be talking about addressing is
science classes.
Yeah, man, every time I forget to bring them one day, I got some really cool glasses. We're going to be addressing glandular tissue and fatty tissue when we're doing gynecomastia. And so some male patients come in and they have both. Some male patients come in and they only have one or the other. And so the glandular tissue is what's usually very problematic. We have a lot of bodybuilders that come in, male bodybuilders that come in, they're like, oh, this looks amazing, but this doesn't match this.
And why? Why is it? It has to be science, right? Because you're doing everything that you can do to lose this. Bodybuilders, I mean, they spend their whole lives in the gym, and then they still have these man boobs, and because it's not pecs, it's not a muscle, it doesn't feel or look like muscle, so you can't really disguise it as like pecs, right?
Exactly. Yeah. So whenever we talk about doing a surgery for this, so a lot of male patients, kind of going back to the bodybuilder, like, I've worked on all this doesn't match. That usually means that they've burned off all that fatty tissue, but what they've got left is the glandular tissue. It almost feels like little BBs or nodules in the tissue, and it's crazy. If you've ever, I mean, if you're feeling a lot of these, you start to feel it. So,
well, I mean, I felt these. I haven't felt those.
Yeah, theirs are usually, it's like pretty nodular.
Isn't it funny that we want them and they want them all?
They're like, they want it flat and tight. So, So when they've worked out and there's still volume there, that's usually the glandular tissue. Because fatty tissue can, you burn fat, right? But the glandular tissue it's not going anywhere until we do a surgical intervention. So the way gynecomastia is, we like surgical intervention.
Let's just all sit in a circle. We're gonna tell you.
Hi, my name is, and I need. So, but anyway, so that would actually be fun. We're going to, I say we, Dr. Sukkar, not I. What he does is he typically liposuctions the chest first to thin out any fatty tissue that's present. We're trying to get things nice and flat and look very masculine. So we clear all that out and thin all that out. Then we make the decision, okay, if there's glandular tissue, does it warrant being removed at this point? And at that point,
is it like a pocket? Is it like
it's usually found like literally right behind the areola. And so what we do is we make an incision at the bottom of the areola. So think of your areola as a watch. So between like 4 and 7, if you make that little swoop like the mouth on a smiley face.
I work with this girl. I work with this genius. Like, okay, so
I'm
now I get it.
This whole process.
So, well, I have an eye watch. So
at the bottom, so say this is the areola. So from the bottom of the areola, we make a little incision, kind of like the mouth to a smiley face, and then go in there and tease that glandular tissue out. Keep saying we, like I'm a mouse in Dr. Sukar's pocket. Dr. Sukkar, you don't want me doing it. I'll be like faint on the ground.
Can I do a quick side note, just because Dr. Sukkar has one day we were doing just a local procedure, and there wasn't a lot of people here, and it was a staff member, so it was okay. So anyway, he let me scrub in. The first chance I get to work in the OR, I knock him out with a mirror. And we both literally just paused, and it looked like he wanted to be mad. He was just like, okay, that's okay. Because he knew that I was learning, and so he's like, it's okay, let's just do da-da-da-da-da.
Let's just get going.
But I was never invited back, and I'm scared to go back because it's intense back there, and they have a flow, and Anyway, okay, just a little side note.
Yeah, so we're at the point where he makes the incision, and he's going to tease the glandular tissue out. Once all that's out, everything looks good on the table, then closure is done of the incision. Super duper tiny, nothing crazy. Once it heals, our patients, it's hard to find that incision. It's like, did we do a glandular excision? If we're just looking at it. So it's,
but
of course,
it's life-changing.
Yeah.
Yeah. So many of our patients have told us how this really does change their life, change their way of...
Well, because you have these men out
they
there...
They can now be shirtless.
Exactly. I mean, it's hotter than Hades here in Texas, 98% of the year. We get a 2% cool point.
And you know what one of the scariest places for a high school boy is? The locker room.
Oh, Lord, yeah. Kids are mean these days.
Oh, yeah.
So, and kind of actually to touch on that, we actually have a lot of patients that come in that are younger men, teenagers, still in high school. They're being picked on. They're just, a lot of things are going not good.
Yeah, you're already not confident. You're already, going through changes, other places. And then on top of that, am I turning into a woman? No.
Yeah.
It's your hormones.
So,
it's their pesky little things, and
yeah. So it's a wonderful thing to be a part of that life-changing process, whether it's for male patients or female, but especially these younger.
Wait, can female have that?
Well, I'm just saying all the surgeries that we do, everything that we do. So so let's touch on recovery for what patients should expect with gynecomastia. Okay. So with gynecomastia, actually most male patients can actually take more of a long weekend. So when they leave here after surgery, we're wheeling you out to your family member. They're going to be wearing a compression vest. So I know your chest is here, so why do we need to wear a vest? We need to apply compression above and below where we've actually done the surgery, because that inflammation, the swelling that's going to happen is going to go where gravity takes it, right? Which is down when we're standing up.
Well, I don't know the process, but it sounds very similar to after breast augmentation.
Very similar, because after breast, we get a little swelling and things down here. Mm-hmm. So the compression vest is super helpful to keep that swelling down. When we have inflammation and swelling, that's when we have discomfort. So if we can get the swelling and inflammation down quicker, then you can start feeling better faster. So usually having this procedure on a Wednesday, Thursday, you can go back to work on Monday. So you're just literally taking a long weekend, okay?
Awesome.
We've
a band.
Yeah, exactly. So garment is going to be worn. I know this sounds like forever, 6 weeks, but it passes in the blink of an eye. I promise.
Oh, I have a question.
Mm-hmm.
Who's more compliant as far as our patients go, women or men?
I don't know. I feel like men misbehave a lot. I feel like they do. They're like,
but you know what?
I don't need to
Ruby,
wear this.
Ruby
she's
tough.
Mm-hmm.
Yeah, and so I bet she does have to be like,
mm-hmm.
I knew you weren't wearing your garment.
You come in not wearing your garment.
I can tell you weren't wearing your garment. You know, she can see it with the swelling and stuff.
Exactly.
Do you get MLDs for this massage?
So it's on a case-by-case basis, but most male patients, when doing gynecomastia, we typically will still do fluid evacuation massages to try to get that fluid out, especially laterally. A lot of times that lateral chest will harbor a lot of fatty tissue, and so in order to really make things lean and tight, Dr. Sukkar will lipo the lateral chest along with the chest itself. So that's where the fluid evacuation massages really come into play to get that fluid out quickly. Now, it's usually a handful. It's not 10 like our full body lipos, but anywhere from 1 to 3 or 4, maybe even 5 if it was a more advanced case. But post-op massages will be super helpful for them. So
awesome.
Yeah.
And then how about protecting your investment, right?
Ooh, we talk about this every single day, all day long. So after surgery,
as much as we would love it if he did, as much as it sometimes seems like he does, Dr. Sukkar does not have a magic wand. The other day he was like, where's my magic wand? Because, he's not changing anything in your body. You're still going to need the same sustenance. You still have to worry about diet and exercise.
You should still, you want to live and maintain a healthy lifestyle. So after surgery, just because we've addressed the problem doesn't mean we can go hog wild and start eating anything we want, doing whatever we want, skipping the gym if we don't, if we normally go to the gym.
Right.
It's
if it took
important.
you a while to get to that point,
yeah,
it's going to take some work to maintain.
Right. So after surgery, you really want to, of course, once swelling and all that comes down, you really want to maintain your weight. You don't want it to come up. We want it to come down a little bit, if anything, if not remain stable. So that's going to be key to protecting your investment of having surgery, because surgery, it's not only a financial investment, it's a physical investment.
Oh, yeah.
And you have to make to have that surgery, to go through recovery, and to maintain
so many
that
people
result.
Say that it's the easy way out.
It is not. And we're gonna have a whole episode on that.
That's one of my hot button issues, because it's just it takes your body through all kinds of emotion. Mm-hmm. Anyway, we'll get into that another day.
Yeah.
But definitely want to protect your investment, both physically and financially.
Exactly. So to kind of circle back and recap on gynecomastia, this is basically a male breast reduction, if you want to just put it out there like that. It's addressing glandular tissue and fatty tissue. So whether you're not in your perfect ideal shape and dealing with it, or if you're in ideal shape except for this, this is a great procedure if you're having issues with not feeling like your chest looks as masculine as you'd like, okay?
Yeah, and sometimes it's not washboard abs. You don't have to, but you can tell that there's something there that shouldn't be there.
Exactly. And, recovery is usually a long weekend, so a handful of days, anywhere from 4 or 5 days. Some patients take 3 days off and they're back at it. We had a dentist that we did gynecomastia on. He was like, I have patients in 2 days. I got to get back. So we're like, okay. But just remember, the more active you are, the more fluid you're going to produce. So just take it easy when you can. And then compression garment, the vest will be worn about 6 weeks after the procedure.
Being compliant is super important in all surgeries. But
Exactly. So I think that's pretty much it. It's nice that it's not an easy surgery. It's easy for Dr. Sukkar, but it's pretty cut and dry. If you have unwanted tissue within the breast area, want to look more masculine, this is going to be the procedure for you. And one thing I do want to add is that if you don't have glandular tissue and it's just the fatty tissue aspect that you're not happy with, we can also do cool sculpting. Just thought I'd put that out there. If
awesome.
You can't have surgery, you don't want to have surgery, don't want to have the downtime, cool sculpting would be really great for that. So I just want to put that out there.
Awesome. Well, you have options.
You do.
You always have options at PS.
Yes, absolutely. So
next week, let me just say, we're going to try to do a PS show, maybe do some recording, but PS is going on a cruise. So,
sailing the high seas.
We'll still be in the office and everything, but Friday we might be out a little early. So if we have all of our stuff together, we'll do our PS show. But wish us well, and
I think that's it.
Yeah.
So, remember, beauty's in the details.
And we'll see you later.
All right, guys. Peace out. Okay, here we go again.
You gotta
Where's the
push
button?
finish
Where's the
right
button?
there, right